Hello everyone, my name is Iziatu Kamara and I'm currently an MPH student over at Liberty University, and today I'll be answering a question pertaining to what makes a good service member for public health for my Health 509 course. Along with answering this question, I was also required to create an interprofessional service program. So, being that I currently work at the hospital, I decided to focus on disease prevention. So, the goal is to just lower the infection rates. So, to ensure that we are reaching our goals, there are trainings that are available for employees, which goes over some of the basic steps, which will help us in the long run, along with performance measures to keep track of how we are doing. Um, I chose to make this my focus, being that this is something we are already working on as a whole and always aiming to improve, especially being that there is a rise in diseases such as the coronavirus, for example. Um, Being that this is a collective effort, I am required to meet and work with other health professionals. So I would say that some of the competencies which I have displayed while working with other health professionals involved effective communication, decision making skills, along with just maintaining a positive attitude overall. Interprofessional, for those of you who may not know, is pretty much the collaboration of two or more professions or professionals. And so, with that being said, when I am asked what makes a good interprofessional service member for public health, I first consider things such as my chosen scope of practice, along with some of the traits which are required of me in order to perform my job duties at the highest level possible. Um, for anyone in the medical or health industry, to fully perform their job duties, there are certain traits which I believe a person should demonstrate and possess, such as compassion, great listening skills, trust, and respect, along with the ability to multitask. A field like public health is not a one man's job, meaning it's a collaboration which will involve shared job duties, different attitudes, and perceptions regarding successful models. So, the things which I believe makes a good interprofessional service member for public health would be a person who possesses and practices autonomy, assertiveness, excellent communication, decision making skills, a person who displays eagerness, takes on the roles and responsibilities, and also demonstrates respect. Um, when working with a group of health professionals, it is important to be able to communicate in a manner which others are able to understand you and relate to you, because we all have different communication methods that we are used to. It is also important to show eagerness because, in my opinion, the more eager you are, the more determined you are to want to succeed and the more successful you will be. Um, Throughout this course, overall, I have learned a lot about the necessary competencies which are needed in public health. I've also learned about the impact of different theories, such as the theory of reasoned action, which explains the relationship between attitudes and behaviors within human action, as well as theory of planned behavior, which links a person's belief with their behaviors, and also the health belief model, which is a behavior change model, which explains and predicts health related behaviors. Overall, public health to me is a broad field. So, in order for anyone to be successful, it is important to know the needs of your community. That is the only way that you're able to know what exactly your focus is going to be, and that will help you again in just being successful and completing whatever task it is that you aim or wish to complete. I also think that that helps you with having a focus, as opposed to you just trying to focus on more than one issue. And so, thank you all for listening, and I hope that my video was informative.